Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. On today's show, we will revisit recent interviews with some of our newest physicians in the community. We will meet Dr. David Butler of Seashore Pediatrics, Dr. Michael Peters of Coastal Carolina Ear, Nose, and Throat, and Dr. Kenneth Hamby, who recently opened the newest Novant Health Oceanside Family Medicine location in Bolivia. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest is Dr. David Butler of Seashore Pediatrics. Well, welcome to the show, Dr. Butler. What a pleasure to have you here.
Thank you very much.
Well, I'd like to start off by finding out how long you've been here. I think you're a newbie, right?
Yes, I've been here 3 weeks now.
Wow, and we've had great weather, so you're probably really happy with
Yes,
that.
it's been great.
Great. So tell me, what brought you to Brunswick County?
It's a nice area. It's a beautiful area. It's a smaller town atmosphere, which my kids and myself really enjoy, and it's just a great opportunity for us.
Well, wonderful. We're happy you're here too.
Thank you.
You're welcome. Well, let's talk a little bit about your education and your background. Tell me, where did you go to school?
I went to Marshall University in Huntington, West Virginia,
Wow.
and I achieved a bachelor's in chemistry there. And then I got my doctoral degree from the West Virginia School of Osteopathic Medicine. And after graduation, I did my residency at the WVU Charleston Area Medical Center in Charleston, West Virginia.
Wow, you're a proud West Virginian.
Yes.
I can tell. I can tell. And of the herd, right?
Yes, ma'am.
Well, I know that you've joined Seashore Pediatrics with Dr. Ludlow, and he was on our show not long ago, actually. Do you have other partners there at the practice?
Yes, we have Dr. Young and Dr. Sanger and Dr. Richards as well.
Quite a few of you there then.
Yes.
Well, I'm curious, where are you all located?
We have 3 offices. The one I'm mostly at is in Charlotte on 3650 Express Drive. And then we have offices in Loris and Long, South Carolina as well.
Well, being a parent of older children now, of course, but when I had young children, I was always worried about sick visits and worried about, waiting to get up in the morning and make that call when the office opened. Tell me how you operate with sick visits. What's your process?
If you're our patient, we try our best to get you in the same day. So if you call that morning, it is our goal to get you in if you have a sick child, because our thought is if you come see us, we should be there to accommodate you when you need us the most.
That's a wonderful philosophy.
Yes.
And when you're on call, do you take your own phone calls?
Yes, we do. We alternate which provider takes phone calls, but we have someone on call 24 hours a day.
So if a viewer out there had a small child, a patient of yours who was sick, and they placed a call to you, it's likely they would get you or one of your partners right on the phone then. Is
Absolutely.
that correct? I think that's very unique, and I think that's, if I were a new parent, that's exactly the kind of practice I would want to be involved with. So I applaud you for that.
Thank you.
I think that's wonderful. And I also think I heard that you guys have different waiting areas for sick children versus well children. Tell me about that.
Yes, we do. We have different waiting rooms. One is a well visit waiting room and the other is a sick visit waiting room. So if you're there with a sick child, or excuse me, if you're there with a routine visit, you're not sitting beside other children who might have the flu or strep or things like that. So your child shouldn't become contaminated with germs.
Yeah, there's nothing worse than bringing your child in for their little checkup and they end up getting sick from their checkup.
Right.
So I think that's wonderful, especially this time of year, which leads me into my next topic of the flu. And since we're kind of in flu season, give us some insight into how you prevent kids from getting the flu. Is there anything you can do?
The biggest thing is prevention, and the biggest thing to prevent it is the flu vaccine. And this year we have two types available, the traditional injection form, and then we have an intranasal form too. So instead of getting a shot, kids can come in and it's a mist that's sprayed into their nose. Now there are criteria you must meet before you're able to receive that. You can't have any ongoing asthma or lung conditions with wheezing, and you have to be older than 2 years old. But if you meet those, you can avoid the typical injection that we associate with the flu vaccine.
Oh, yeah, I was wondering what would make that decision whether you would have the shot, the injection, or the vaccine. Do they both work equally well?
Yes, they do. They're both very effective.
Well, that's good to know, especially for those kids who don't like those needles. You know,
Absolutely.
That's great. I wondered what do parents do if they find out their child does have the flu? What would be some of the things they might have to do?
If you suspect your child has the flu, we encourage people to come to the office right away. There is a medicine, which is rare for a viral infection, but there is a medicine for influenza. And if we can confirm it is the flu, we're able to start that. And if we start it within the first 48 hours of symptoms, then it is very effective to cut down the duration of the illness and the severity of it. If you're outside of that 48-hour window, the biggest thing is just take care of your child. Lots of fluids. Warm fluids are very good. They feel better on the chest. And then fever control.
And typically, how long does the flu last?
Typically, it can last a week to 10 days.
Wow.
The worst part of the symptoms are generally the beginning, the first 3 to 5 days. But it can last as long as a week.
Yeah, nothing worse than a sick baby at night and with the fever, and that's a long time. So, well, that's really great information. I'm sure our viewers will find that very interesting. Getting back to you, I was wondering, do you have any special interests or areas of focus that you are particular about?
My favorite is newborns.
Of
I love
course.
newborns through toddlers, and they remind me of my own children.
Of
so
course
I
they do.
enjoy those the most.
Well, Dr. Butler, are you and your partners currently accepting new patients?
Yes, ma'am, we are.
And how might they schedule those appointments? Do you have a phone number?
They can feel free to call us at 910-754-BABY or 2229.
I love that phone number. It's baby is so easy to remember.
Yes.
That's great. Well, Dr. Butler, it's been a pleasure to have you on the show today.
Thank you.
I look forward to seeing you again real soon. We'll have you back, and maybe we'll talk about sunburn in the summer, right?
That sounds great.
Okay, great. Thanks again for joining us.
Thank you for having me.
You're welcome. Our next guest is Dr. Michael Peters of Coastal Carolina Ear, Nose, and Throat. Dr. Peters, thanks for joining us today.
Well, thanks for having me.
It's a pleasure to have you here. Now, I know that you're with Coastal Carolina ENT, and how long have you been with them?
I've been with them for 2 months now, a little over 2 months.
Little over 2 months. But I think you were here once before, is that correct? You were in the area, and then you went off to do something else?
I was in Little River, North Myrtle Beach area in solo practice for 6 years. I left for a couple years for some family reasons, and we had such a good life down here, we decided to come back and live here again and resume my practice with Coastal Carolina ENT.
That's a great practice. I know of it personally, and I think they do a great, great job. So let's talk a little bit about you. Introduce yourself to the community, and tell us a little bit about your education, your background.
Okay. Well, I finished my bachelor's degree when I was in the service, and as soon as I was discharged, I started medical school, and I did medical school in Brooklyn, SUNY downstate in Brooklyn. So
Great
I
school.
often say I went from one war zone to another.
another.
So while I was there, I was able to do a visiting rotation at the University of Minnesota in otolaryngology head and neck surgery, and was lucky enough to get into that residency program. So I did my residency there. And after my residency, I decided, well, I didn't decide, they chose me to stay there for my facial plastic and reconstructive surgery fellowship. So I was really fortunate to get into that program there.
Wow, quite a background. That's a very impressive educational background.
Thank you.
So now I heard you say you were in the service. You were in the Navy. Is that correct?
Yes.
And how was that for you? Did you enjoy the service? And
It straightened me out.
well, that's one way of putting it.
It was good. I was a hospital corpsman, which is the Navy and Marines form of a medic.
Okay.
And I served on both coasts, and both with the Navy and the Marines, and was honored to serve with the 1st Marines and Fleet Hospital 5 with the ground troops over in the first Gulf War.
Oh,
So
wow.
it served me well. I probably would have stayed in, but after the Gulf War and having family, I felt I should probably get out and do what I wanted to do. So I miss it to some degree. But.
Wow, that's real interesting. I was happy to learn more about your naval career. So let's talk a little bit about your practice. Where are you located?
Well, my primary location, actually the location I only see patients now, is in Little River, just over the border into South Carolina. We have other offices in Charlotte and an office in Whiteville where my partners go.
And do you have privileges at one of the local hospitals?
I do all of my inpatient procedures at Brunswick Novant Hospital. And I'll do some other outpatient procedures for locals down in a surgery center in South Carolina, but I probably do half of my procedures at Novant Brunswick.
Great, great. We're really pleased to have you here in the area. I think you bring a wealth of experience to this area.
Well, thanks. I've been impressed with the hospital and the operating rooms, and I'm looking forward to bringing more cases there, actually.
Great, great. Well, now we've had Dr. Corey on the show in the past from Coastal Carolina ENT, but I think you have a couple of other partners, and do you want to share those with us?
Sure. Dr. Kenyon, he's the partner who started the practice years ago, and Dr. DeMuzio. They're the other two that cover the 2 offices in North Carolina.
That practice has grown. It's up to 4 physicians now, so it's really grown a lot. Some folks are not familiar with what an ENT doctor does or is, so do you want to talk a little bit about that for our viewers?
Sure. It's the most difficult specialty to pronounce. Otolaryngology, head and neck surgery is the formal terminology, but basically we treat diseases of the ears, the nose, the throat, pretty much everything above the neck, not including the brain, the spine, and the eyeballs themselves. And it's a pretty broad spectrum set of disorders we treat. It can be anything from as simple as giving medications to doing surgery with microscopes and removing cancer and reconstruction and trauma. So it's a fairly extensive field of diseases that we treat.
Now, I know you did a fellowship in plastic surgery.
In facial plastic and reconstructive surgery.
Let's talk a little bit about that.
Sure.
What kinds of procedures might that entail?
Okay, well, the training initially was pretty well broad spectrum facial reconstructive
Would that be like after
treatment.
an accident?
It was
like that?
after an accident, trauma, skin cancer reconstruction, head and neck cancer reconstruction, cleft lip, cleft palate repair in children, trauma, cosmetic surgery.
So you do cosmetic surgery?
I do, yes. And that's probably about 30% of the reconstructive work I do. Most of the reconstructive work for medical problems or for diseases usually requires that we remove something bad, and then we want to fix things so that they work well and look good. So that kind of feeds into the cosmetic part as well. So I like doing the cosmetic part. It helps keep my skills up for the reconstructive part, but the reconstructive aspect for diseases is more rewarding.
I'm sure. Especially, I know you see children, is that correct?
I do.
And you do cleft and palate reconstruction?
It's a little bit harder to do now in the private sector. You really need a more concentrated team.
I see.
I'll do some revisions and treat some secondary cleft palate and cleft lip work, but I've left that work to the larger universities where the children can be taken care of with a more comprehensive team.
Yeah. Now, the procedures that you were speaking about, are those mostly inpatient or outpatient procedures?
Outpatient. The majority of the skin cancer work I do can be done right in my office.
Oh, that's great.
It saves time, saves
Well,
money.
it's cost saving.
Cost
Yes.
savings. For people who aren't comfortable doing it in the office, we can do it in the hospital or outpatient
Yeah, they don't want to know
surgery
what's
setting.
going on.
Exactly. So rarely, if ever, does anybody have to spend more than a night in the hospital. But I'd say better than 95% of the patients are going home the same day.
Is there a common procedure that you do most often? I'm just curious. What do you do the most of?
As far as reconstructive work, the three probably most common reconstructive procedures are skin cancer removal and repair.
Yes.
The second is nasal reconstruction. And the
Like
third,
I had a broken nose, and I have this deviated septum thing. Like I can't breathe out here, and you could fix something like that.
right, that part, or even more complicated things where people have been operated on before and they need revision work. So that tends to be my area of specialization, nasal reconstructive work. And then thirdly, eyelid reconstruction for vision, for the upper eyelids if the eyelids are drooping, or for the lower eyelids if they're drooping and they cause infections and irritation of the eye and the eyeball. So those are the three most common areas that I treat.
And then in terms of cosmetic surgery, what would be your most common?
Probably rhinoplasty, the nasal reconstruction, or nose job.
Nose job.
And,
I was thinking it was going to be eyeballs,
eyelids.
eyelids.
Eyelids are right there with it. I've probably done as many as both. As many eyelid reconstructions as nasal reconstructions. And then I'm very selective in the facelift skin tightening procedures. Those are big procedures, and I like people to get good results, excellent results, so I'm very selective in when and if I'll do those.
So are you currently accepting new patients?
Always.
Good. And how might we contact you if we'd like to schedule an appointment? Do you need a referral or anything like that?
No referrals are necessary. Referrals are typically needed only if the insurance companies require that a patient needs a referral. Either the patient's family doctor can call and schedule with us, or they can call directly, or any of our offices. But for me directly, we have a phone number for our office in South Carolina.
I'm so glad you were here today and let us get to know you a little better and let our viewers get to know you. So I hope you'll come back and visit us again sometime and we'll talk about something different.
Well, it's been a pleasure, my pleasure.
Well, thank you again.
Thank you.
Our final guest is Dr. Kenneth Hamby of Novant Health, Oceanside Family Medicine in Bolivia. Well, welcome to the show today, Dr. Hamby.
Thank you. I'm very glad to be here.
It's such a pleasure to have you. I'm so excited to learn all about you today. This is going to be a great interview. So I know that you just recently moved to the area. So where did you practice before you joined Novant Health?
Well, I was previously practicing in Pawnee, Oklahoma with the IHS facility, the Pawnee Indian Health Clinic. I had an obligation there, and it was a great place to practice. I really enjoyed working with the Native Americans.
What brought you to this area? How did you find Brunswick County all the way from Oklahoma?
Well, we did a little research. We spent a year looking for our basically a place we're going to retire. So this is a place that we...
You're too young to retire.
Oh, of course, but someday, someday. Exactly. We wanted someplace where we sink down roots, and this was a destination close to the coast. I dreamed all my life about living by the ocean, and we vacationed in the Carolinas, South and North Carolina, throughout the years, and just love the people, love the spirit and the things to do. I love biking, kayaking, and fishing, and they're all available year-round, and it's a dream.
Well, let's talk a little bit about your education and your background. Now, I know you said you had an obligation to the Pawnee Indian tribe, and so is that how you went to school? And
Yes, coming out of high school, I went in the U.S. Army and spent 3 years as a medic, and I really got I got some good training there. And then coming back, I worked with the post office, but I loved having those medical skills as an EMT, and so I joined the Air National Guard, and they offered a college tuition waiver, and I was able to go to school at night, and I got my prerequisites for medical school, and so going into medical school, I needed some help financially there, and
Sure.
and being part Cherokee, I
Really?
approached the Native American population, and they were more than glad to pay for medical school if I would give them a payback obligation of year to year, and it was a great decision.
so you're in a brand new practice here in Brunswick County. So let's talk a little bit about that. It's recently opened.
That's correct. It's a brand new family medicine practice, but it is part of Novant Health Oceanside Family Medicine, and it is the Bolivia branch, and it's right across the parking lot from Novant Health Brunswick Medical Center, and great location.
Perfect location. What a great landmark. You can say, yes, I'm located just next to the hospital.
You can't beat it. I've got the best surrounding physicians to refer to, and get to go just across there and meet with the staff and the great volunteer staff they have. I just love it.
Wow, I'm sure they love you too. So the office is located in that medical office building there that's right across, and so you do have some peers right next to you. You have the surgical services, and you've got Brunswick Women's Center, and so you've got quite a few
That's correct.
practices in there.
Cardiology, urology. You know, we're trying to become very easy for the patients to find, and for referrals so they can literally walk a few hundred feet.
That's right. Now, I know that you're a doctor of osteopathy, and that might be a kind of a strange term for some of our viewers. So if you would, please, could you talk a little bit about the difference between osteopathy and...
I would love to. You know, as a medical student going into medical school, I had choices between allopathic or osteopathic. One of the advantages to being an osteopathic medical student is you learn a different base philosophy. Instead of just focusing in on a disease process, I like the idea we take on the whole person. We look at the disease as only a part of the whole, and when we're treating somebody, it's a philosophy to prevention of medicine, prevention of disease, looking at vascular, neuropathic, and lymphatic flows, and to look at proper alignment, and to look at the spine, and to be able to put your hands and diagnose and manipulate the spine, manipulate joints, so that you can do more than just, you know, giving some medications. But what I did enjoy about that is that we all train at the similar residencies.
Sure.
We take the same type of boards.
Right.
The qualifications are identical. There will be very little difference between the training, except for that, what I feel is an extra ability to do manipulation.
Yes, I like the concept of treating the whole person, because you know, we're a person first.
That's right.
Who happens to have an ailment.
And my philosophy is that it's a partnership, and the patient is there to, you know, get good health, and we're going to help them every way we can.
And so, in your practice, you're the solo practitioner currently.
That is correct. The plan is to eventually grow into a second provider, but right now I'm in a solo practice, and we are available to take new patients.
Speaking of patients, you see both adult and pediatric patients?
That is correct. We're restricting age 2 to 100.
Age 2 to 100. Okay, I'm going to make a note of that.
No, we do feel like the pediatricians probably will help with the infant care and some of the special needs pediatrics, because we do focus more on adult medicine, but we do offer services for the whole family, so we hope to have families in groups or individuals, and we want to be available for the needs of the entire population.
So you are truly a family practice.
That is correct. I trained in family medicine in Athens, Ohio, where trained at Oblenis Hospital, part of the Ohio University program, and the emphasis was on the entire family there, and diabetes prevention, and working with a difficult population there with obesity and tobacco use. I feel like I was well trained up until this point for the needs of North Carolina.
You mentioned diabetes, and we know there's a huge diabetic population here. Do you have a special interest or a special area of focus that you'd like to
Yes,
look at?
Working with the Native Americans, it became a very prominent focus of my practice, was managing diabetes care, and I really have a passion for it. Managing people's lives, helping them lose weight, helping them learn the processes that are causing and leading to the disease, and to help them use the medications that are available to properly manage their disease. It gives me great pride when I can get somebody under control and explain to them how this is going to make them live longer.
Yeah, I'm sure it does give you great satisfaction to do that. Now, I believe you said you are taking new patients.
That is correct. We are a brand new practice, so we have an open schedule, and we're very excited to be here, and we have available slots for all family members.
Yeah, let's talk about your hours of operation and what have you. Are you there 5 days a week?
We are. We're there Monday through Friday. 8:30 to 4:30 is our operating hours. We do plan on making an extended hour clinic in the future, so it will be based on when we get another provider, but right now that's our hours of operation.
Well, that's good to know, and sometimes it is difficult for folks to get to the physician's office during work hours because of their work schedule, and so it is nice to have some practices in the area who do have extended hours, so I'm sure that'll happen before too long. Once the practice grows and you have to get another physician or another provider in there.
This area is growing so rapidly, and it was definitely an area that we wanted to be part of because of that potential growth. And we're excited about the opportunity to be on the ground floor of this beautiful hospital, beautiful clinic. I encourage everybody to come see us and check it out.
That'd be great. So I know we've got viewers out there who don't have a primary care physician and are looking for one. So can you tell our viewers how to reach you?
Yes, our clinic is 584 Hospital Drive, right next off of Highway 17.
Right.
Our phone number is 910-721-4100.
4100. Well, wonderful, and we'll be glad to give that number out. If folks call, we'll be glad to furnish them with that number. So before we close, is there anything else you'd like to add or share with our viewers?
Well, I'm very excited, like I said, to be here. This is a great opportunity, and I think as a physician, it is my honor to treat the patient. I always go into each encounter with a smile and a handshake, and patients should expect to reach a high standard of care, because that's what I am looking to give. As Novant expects a standard of excellence, and that is why I chose Novant, and I wanted to be part of that. And I treat each patient like they're a family member, and I want them to think of me as their doctor and one that they can go to and trust.
Oh, that's wonderful. You're going to make me cry.
Yeah. It's a long journey here, and like I said, I'm so thankful to be here.
Well, we're so happy that you're here. I think you'll be very, very successful. So thanks for being here today. I look forward to having you back when you tell me about your new provider.
That sounds wonderful.
Okay, great.
Thank you so much, Jim.
Thank you. Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit novanthealth.org for more information on Novant Health, Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.